So first I would like to ask you for your permission to use this video for educational purpose and on internet. Do I have your permission? Do I have your permission to use this video?
Yes, you do. You have my permission.
Now tell me about how were you? How were your symptoms before the surgery?
I was in very bad pain, especially lower back and nerve pain down my 10.
Okay, how bad is the pain now?
Oh, a 4 off and on.
Okay.
Not, most of the time, not even that bad.
Okay, and the leg pain was as well 10? Was the
Yes.
leg pain 10? How bad is the leg pain now?
Oh, maybe about a 4, and it's not really a pain, it's more of a weakness.
Yes, yes.
The pain is pretty much gone except for occasional pain.
Yes. Now, you had a very complex fracture in your spine that was pushing on the nerves. And you were practically bedridden for a while before this. Now, what we found out that you had a broken bone in your back, and that broken bone, piece of the broken bone was pushing on the nerves. And that's what's causing your problem. Our surgery just was about 4 weeks ago. So it hasn't been really that long. And the pain you're having, pain that you're telling me was 10 of 10, and now it's 4 of 10 with certain activity. That is pretty good actually, considering the surgery just was 4 weeks ago. Here is what we did. We in the surgery, as you see, the L4 is completely broken. So we bridged the broken bone by putting screws above and below, and then take the back of the bone away and give a spinal cord literally more space to expand and not be squeezed by part of the bone that are pushing on it. And we made a 7-hour surgery to a 1 hour and 16-minute surgery with 150 cc of blood loss. And you actually sent me a picture about how you look like after the surgery. Do you mind to have that picture? Now, from your observation, when was the pain gone after the surgery?
I would say immediately.
Excellent. And I think the reason for that is because we bridged the broken bone, so there was no more stress on the broken bone. And I think we have a long way to go. And here is a picture of you right after the surgery smiling. And now, may I ask you, how was she before the surgery and how has she been after the surgery?
Before the surgery, she was in so much pain, and it seemed like it just kept getting worse and worse, and she was having trouble walking. After the surgery, as you can see by the picture, she had that big smile, and you could tell that she was feeling so much better.
Excellent, excellent. Well, I think this is most important question the take home from this is that, yes, it was a risky surgery, and it was a big surgery, but the way we did that with new technology, with the minimal invasive, we made literally a 7-8 hour surgery to a 1 hour and 16-minute surgery, and we reduced the risk of the surgery to that amount that was, even with considering all your other medical problem, it still was a reasonable surgery for you, whereas open surgery would have been way too risky. And I think so far it has worked. We have a long way to go, but I think I'm pretty happy with where we are. All the hardware are in perfect position, and I think the next step is just doing more physical therapy and getting you back on your feet. It's going to be a long way, but we are on a good path. Any comment? Any questions?
I have a comment. Make sure that everybody knows that I'm 82 years old.
Yes, and you said so far you're very happy with the result. Thank you, I appreciate that, okay?